All right, ready? Here we go, huh? Hi, I'm Cindy. I'm going to be your nurse practitioner student today. Today I'm going to be doing a head-to-toe assessment on you, and if anything hurts or anything is bothersome, please let me know. So the first thing I'm going to be doing is looking at your overall appearance, looking your general well-being and your mental health. So it looks like you're appropriately dressed and in no acute distress. I'm going to be examining your skin throughout the exam. I'm going to be looking at the temperature, the moisture, any scars, hair distribution pattern, trigger. All right, so the first thing I'm going to have you do is put your hands out. Going to be feeling here, looking for any bony abnormalities. Let me know if anything hurts. No, okay. Cap refill is brisk at less than 3 seconds. Going to go ahead and have you do that. Looking for any clubbing, see the window, negative for clubbing. Go ahead and relax your arms down. Going to just go ahead and feel here for your pulses. Whenever I assess for pulses throughout this exam, I'm going to be doing rate, rhythm, amplitude, and symmetry when applicable. So rhythm at 72, rate regular, 2+ out of 4, and symmetrical. Alrighty, so now the next thing, Kaya, I'm going to do is I'm going to go ahead and have you grip my fingers here. We're going to just test your strength. Good. So strength there is 5 out of 5. Now I'm going to go ahead and feel your wrist. I'm going to go up your arm looking for any bony abnormalities or sores or any skin issues. And I'm stopping at the olecranon, any pain, going up to your shoulder, going to the glenohumeral joint, tickle. Okay, going onto your wrist, going up your arm, going to the olecranon again, all the way up, feeling in that glenohumeral joint, nothing there. So now we're going to go ahead and do some strengths. So I want you to put your hands like this for me, Kai. Okay, resist against me. So that is biceps 5 out of 5. Go ahead and put them up. Good. Triceps 5 out of 5. Arms out like this for me. Deltoid strength 5 out of 5. Now we're going to just do some exercises. So follow me. I'm going to have you place your arms out like this. First, I'm going to have you bend them up for flexion, out for extension. Then I'm going to have you bring them in like this for abduction, out like that for abduction. And then we're going to do internal rotation. I'm going to be looking at good. And then we're going to go this way for external rotation. Good. Again, looking good, full range of motion there. Okay, then I'm going to have you put your arms out like this. I'm going to have you put your palms up for supination and down for pronation. Good. So full range of motion of the shoulders and the upper arms. All right, next we're going to go on to your hair. Looking at hair distribution, your hair distribution looks normal. I don't see any infestation. I don't see any rashes going on to your eyes. I'm looking for any lid lag. I'm also looking for exophthalmos. I'm also looking for edema, none of which that I see. Now, Kai, I'm going to go ahead and have you watch my finger. We're going to be doing a test. I'm going to be checking cranial nerve 3, ocular motor 4, trochlear, and 5 or 6 abducis. Go ahead and follow my finger with just your eyes. Looking for any nystagmus, doing the H pattern. Good. So no nystagmus and good ocular movement. Now we're going to do the test for convergence. Going to have you look here at my finger and then out at the wall. Back at my finger. Keep your eyes open for me. Out to the wall. Good. And back again. So pupils were dilated when he was looking, or were constricted when he was looking close, and dilated when he was looking far away. So again, convergence intact. Gonna go ahead and now look at your sclera. Okay. Go ahead and look up for me, down, side to side. Good. Up for me, down, side to side. Clear conjunctiva. Sclera is white. Now I'm going to be testing your pupils. I'm going to have you just look straight ahead at me. Good, direct. Good, direct. Now I'm going to look for consensual. Kai, just keep your eyes open. Good, good consensual pupillary response. That's checking optic nerve 2 and ocular motor 3, which were both intact. Okay. So now we are going to go ahead and go on to your ears. Do you have any problem hearing? Nope. Okay, go ahead and cover your ear over here, and I want you to whisper back. Yeah, good.
Baseball.
Good. So he was able to whisper back words. So no hearing deficits, indicating that the cranial nerve 8 acoustic is intact. Now I'm going to just feel your ears. Any pain?
No.
No. So tragus none. Auricle none. No redness, no swelling. Now I'm going to just go ahead and look in. Oh shoot. Okay. I did forget to do your eyes. Let's do your eyes first, okay? Since I've got it all hooked up here. I knew I was forgetting something. So I'm gonna have you look out straight ahead for me, okay? Here I am gonna be looking for that red reflex, which I see going in. Looking at all four corners, good. Gonna come to the other side, straight ahead for me, bud.
Okay.
Good, straight ahead, good. Looking at all four corners, good. So I was able to see that the optic disc was orange in color. There was no AV nicking. The margins were clear and sharp. There was no hemorrhage and no lesions bilaterally. All right, so now we're going to do the ear exam. Here I'm going to be using the 3-point bracing technique. Looking in your ear, good. Coming over to the other side again, 3-point bracing technique. Looking in the ear, good. So minimal cerumen, the tympanic membrane on both ears was pearly gray. There was no lesions, no mucus noted. I was able to observe the bony prominence on both ears, and there was conolite in both ears. Now I'm going to look at your nose. Okay, so tip your head up for me. Again, using 3-point bracing. Looking in your nose, good. Gonna do 3-point bracing here as well. Looking in your nose, good. So was able to look at both septums, but which were midline, no deviation. There was turbinates were non-boggy. I saw no polyps, and the mucosa was pink. All right. Do you have any problems smelling? No. So that indicates that your cranial nerve 1 olfactory is intact. Now we're going to go on to your mouth. I'm going to pretend like I have a tongue blade. I'm going to have you look, open up, look, look at the top, look underneath. So didn't observe any dental caries, no leukoplakia, no lumps, no blocked ducts. Now I'm going to go ahead and have you stick out your tongue and say, ah, looking at the uvula. So cranial nerve 10 is intact. The vagus, he is able to, I saw his uvula, it was midline, and his soft palate rose and fell without, with symmetry. All right, so now tongue, I'm going to have you stick out your tongue, good, and move it from side to side. That is cranial nerve 12, that's the hypoglossal, which is intact. There was no deviation, full range of motion. Are you able to have any, are you having any problems tasting, any changes? No. So that indicates that cranial nerve 7, and, which is the facial, and cranial nerve 9, which is the glossopharyngeal, is intact. Now, Kai, I want to go ahead, I'm just going to pretend like I'm palpating your mouth. So nice and big, I'm feeling both sides. I'm feeling the hard palate, feeling under, feeling both lips. I'm going to have you stick your tongue out. I'm going to be palpating the tongue. No lesions noted, no lumps. I did not see any blocked ducts. Okay, so that is it for your mouth. Now we're going to go on to the trigeminal cranial nerve 5. I'm going to go ahead and have you clench your jaw. Good, so good strong muscle there. Now I'm going to go ahead and have you open and close your mouth. Again, open and close. Open and close, good. So no audible clicking and no crepitus, so cranial nerve 5 trigeminal is intact. All right, now we're going to go on to cranial nerve 7, which is your facial. I'm going to have you raise up your eyebrows, good. Now close your eyes for me, resist against me, good. So 5 out of 5 muscle strength there. I'm going to have you smile really big, showing me your teeth, frown for me. Okay, go ahead and puff out your jaw. So good, fascia symmetrical, that's good. So cranial nerve 7 facial is intact. Now we're going to go on to cranial nerve 11, and this is the spinal accessory. Shrug your shoulders up against me, good. So 5 out of 5 on the trapezius. Now I'm going to go ahead and have you push your hand against me. Good. And on this side, good strength there. So the sternomastoid, 5 out of 5 on both sides. So that cranial nerve 11 is in the spinal accessory is intact. Okay, now we're going to go on to your glands. Here I am going to be feeling for the pre-auricular glands, none, post-auricular, going down back to the occipital, feeling down, just feeling for any glands. Go ahead and put your head up high. Going into the tonsillar area, submandibular, good, submental, good. Going to go to superficial cervical, going to the deep cervical chain, so pushing a little deeper, then going on to the posterior cervical. Going to the supraclavicular all the way out, looking for any nodes, and then the infraclavicular, looking for any nodes that are greater than 1 centimeter. None was noted. There was none that were fixed, and no pain on that, Kai. So no pain or no swollen nodes. I'm also going to do the central axillary node, which is up in your armpit. Sorry, bud. Good. Okay. Let me do this side now. Gonna push up in there, good, central axillary, and there was no palpable node greater than 1 centimeter there. All right, so now we're gonna do some neck range of motion. So follow me, head down, so good flexion, look all the way up, good extension, back to midline looking at me, maybe turn your head from side to side, good full range of motion. Then ear to shoulder, full range of motion of the neck. Now I'm going to grab my water. I'm going to have you just take a sip. Oh, is this one?
Yeah.
Okay, I'm going to have you take a sip of the water. Let me just check. Good. Trachea fall is midline without deviation, no swelling. Okay, didn't see any swelling there. Now I'm going to go around to the back. Kai, here I'm going to test your thyroid. I'm going to feel for your thyroid. So I'm going to put my hands around your neck. We feel for that cricoid. Good. Okay, go ahead and swallow for me. Okay, good. So I'm feeling thyroid. I'm displacing, feeling on each side, just feeling for any nodules, feeling the size. It doesn't feel enlarged, and I did not feel any nodules, and there's no goiter present. Alrighty. Now we're going to go on to the spinal. I'm going to check your spine, looking for any step-offs in the spinal, bony spinous area. Just going all the way down. Let me know if you have any pain, Kai. Good. Anything there? No?
No.
And then we're going to go ahead and check the paravertebral muscles, feeling for any spasms, feeling for any knots. Any pain there, Kai? No. So negative for spasms and no drop-offs in the spine. Now, Kai, I want you to sit up nice and big. Take a big deep breath in and out of your mouth. Good. So chest expansion was symmetrical. Also going to look at the AP diameter, looking at the AP versus a lateral. It's a 1 to 2, indicating no chest abnormalities. Now I'm going to go ahead and have you lean forward. Going to find about the T10. Now deep breath in and out. Expand those lungs big. One more time for me. Good. Okay, so rise and fall was symmetrical in my hands, indicating that the lung expansion was good. Now we're going to do some deep, I'm going to be listening for some breath sounds. Kai, every time I touch this to your back, I want you to take a deep breath in and out, okay? Using the diaphragm, deep breath. Again. Okay, going to do the middle lobe as well. Go ahead and lift your arm up, deep breath in and out. Right middle lobe, sounds clear. So there was right middle lobe and all the lungs sounds were clear to auscultation. There was no wheezing, no crackles, no rails, no adventitious breath sounds, as well as in the right lobe. Now I'm going to listen from the front. Kai, same thing. Every time I touch a deep breath in and out. One more time. Good. Again, from the anterior, clear lung sounds, no adventitious sounds. There's no crackles, rails, wheezing throughout. Now I'm going to be listening to your heart tones again using the diaphragm. This you just breathe normal for me, Kai. Okay, going down to the just normal second intercostal space along the sternal border, just normal. Don't have to go through that. Good, so here I'm doing aortic, going over to the left, second intercostal space, listening for pulmonic, going down to third, fourth, fifth intercostal space, listening to the tricuspid as well as the right ventricle, going on to the mid-clavicular, fifth intercostal space, listening for the mitral as well as the left ventricle. Okay, normal S1, S2, no S3, S4 or splitting heard. Okay. All right, so Kai. Now we're gonna go ahead and do your, I'm gonna look at your your breasts, okay? So hands on your hips. Good, looking at your breast, looking to see that they're symmetrical. I'm looking for orange peel sign, looking for any dimpling, nipple retraction, any sores, lumps, anything that I can see. Nothing is I can see nothing. Go ahead all the way up. Again, looking for those same signs, negative for orange peel, negative for dimpling, nipple retraction, anything like that. Okay, good. Now, Kai, I'm gonna go ahead and have you lay down. We're gonna get to your breast exam here. Good. Okay, you're gonna put your arm up over your head. So the first thing I'm gonna do is I'm gonna be using the palms of my fingers, and I'm gonna be starting in the tailless fence, doing a circular motion, light, medium, deep, making sure that I get all the breast tissue going all the way up to the clavicle, coming down the breast, light, medium, deep, circular motion at the nipples, checking to make sure that there's no drainage going on all the way up to the clavicle, and doing a horizontal motion. Okay, once that's done, then I would go to the other side of the patient, but because of the couch, I'm not able to. I'm gonna put that arm up. Good. Just relax it. Okay, bud. Okay, starting in the tailless fence again, circular motions, light, medium, deep, light, medium, deep. Feeling for anything, going all the way up to the clavicle, going in a horizontal motion, making sure not to miss any breast tissues, light, medium, deep, palpating for any lumps, anything, any abnormalities, looking to see if there's any pain on the patient, if they're experiencing pain. Anything hurting, Kai? No. Okay, I forgot to ask you, when I palpated your thyroid, did you have any pain there? No. All right, so no lumps, palpable lumps, no nipple drainage, tissue is smooth. Alrighty, now I'm gonna go onto your carotids. Okay, gonna do those one at a time, feeling. So rate at about 72, 2 plus amplitude out of 4. Regular, gonna do the other side. Rate is about 72, amplitude 2 plus out of 4, and regular. Now I'm going to be listening for your, listening at your carotids for any bruits, using the bell. Good. And stop breathing for me. Good. So no audible bruits. Going to go down to the heart, listening for any murmurs. Again, second intercostal space on the right sternal border. Listening to aortic. Going on the other side to the left, second intercostal, pulmonic. Going down to 3, 4, 5, listening for tricuspid, going on to the mid-clavicular, fifth intercostal space for the mitral. Good. No audible murmur heard. Going to find the point of maximal impulse going down on the fifth intercostal space, mid-clavicular, feeling there, amplitude 2 plus, it's non-displaced, and it's not enlarged. Okay. Next, I'm going to listen again. This time I'm going to be listening to your aorta and your renal and your iliacs. First the aorta, then the renal, and the renal again, and then the iliac, going on to the other iliac, and no audible bruits noted. Now I'm going to be listening for vowel tones. Going to switch over to the diaphragm on my stethoscope, listening in all 4 quadrants. Hearing lots of gurgling, normal active vowel tones in all 4 quadrants. Alrighty, so now I'm going to inspect your abdomen, looking for any abnormalities, looking for any striation, hernias, anything. I'm not seeing anything there. Now I'm going to do some palpation, okay? So I'm going to do light, and I'm going to be doing this in the 9 regions. First, just feeling for any lumps. Let me know if anything hurts. Okay. Looking at your face, seeing if you're having any grimacing, which I don't see. Now I'm going to go on to deep palpation, which is about 3 centimeters. Sorry, bud. Just here again, feeling for any lumps, feeling for any abnormalities, masses, not feeling anything there. Now I need to do your liver. No tickle, tickle. Okay, deep breath in and out. Good. Not able to palpate the liver. Borders. Indicating no enlarged liver. Going onto the spleen, relax. Going onto the spleen, feeling another deep breath in and out. Good. So not noting the borders of the spleen, which indicates a normal spleen, a normal size spleen. Okay, go ahead. Put your leg. Oh shoot! I forgot to bend your legs when I did your abdomen to make you relax. Okay.
That's why I kept putting my feet
Oh, thank
up.
you, buddy. Okay. So now I'm going to have you just go ahead and put these down. I'm going to feel your femorals here. Okay. Feeling the femoral artery, rate is about 72, symmetrical, regular, 2+ out of 4 in amplitude. Feeling the inguinal area here, just feeling for any nodes, no palpable nodes there. Now I'm going to go on to the legs, looking for muscle mass, symmetry, hair distribution, any bony abnormalities or lesions. Just going to palpate, let me know if anything hurts. Going to do the quads, going down to the knee. The patella, going on down the shin. Going to feel the calf. Don't feel any warmth or heat in the calf. Going to be pressing here on the shin, looking for any pitting edema, none noted. Going down to the foot. Slimy. Now I'm going to do the other quad, going down to the patella, feeling the patella, going down the shin. Then I'm going to just do the calf, not feeling any warmth or no tenderness. Is that correct? No tenderness, feeling the feet. So no bony abnormalities, muscle mass is equal, and no redness, no tenderness anywhere. Now I'm feeling for the dorsal pedalis pulse, feeling for rate, rhythm, symmetry, and amplitude. So 72, regular rhythm, amplitude 2 out of plus, and it's symmetrical. Now I'm going to have you do some active range of motion. Going to have you do some dorsal flexion, pull your toes up towards your head. Going to go ahead and have you point your toes towards there. That is plantar flexion. Put your toes in like that, inversion, and then I'm going to have you put your palms, soles of your feet together, eversion. Good. So full range of motion on the ankles. Now we're going to do some range of motion of your hips, okay? And I'm going to just be doing this for you, okay? So going to do some flexion all the way up. Going to do some extension. Then I need to do some abduction. Going to check here. Going to do some external rotation, and then internal rotation. Good. Going to move on to your other. So flexion. Good. Going to extend that out. Good. And then we're going to do adduction. What's so funny? Come on. Bend your knee. Okay, then we're going to do external rotation, internal rotation. Good. So full range of motion of the hips. Okay. Now I'm going to go ahead and have you sit up for me. Here we're going to do some cerebellar testing. I'm going to be testing what's called the rapid alternating movement. I'm going to have you first do your the palms of your hands and the back of your hands, palms back, and get going faster. Good. So good symmetry, good coordination, good rate. Okay, you can go ahead and stop there. So cerebellar is intact. Okay, now we're going to go ahead and go to your reflexes. Okay, so deep tendon reflexes. First thing we're going to do is the bicep. Okay, 1+. Going to do the brachial radialis. Good, 2+ there. Going to go ahead and do the tricep. Good, 2+ there. Going to go ahead and do the tricep here, or I mean the bicep. Good. I'm going to do this a little bit. Hold that there. Good. 2 plus. Going to do the brachial radialis. 2 plus there. Going to do the tricep. 2 plus there. Going to go ahead and do the patella. So just relax, bud. Relax. 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 You're not even doing it. All right. 2 plus. Relax. 2 plus on that side. Okay, now we're going to do the Achilles. Good. 1 plus. Other Achilles. 1 plus on there. Good. So those are intact. Okay. Now I am going to go ahead and have you stand up. We're going to look at your spine. Go ahead and turn your back to the camera. All the way around. Okay, going to be looking at the spine, looking at the curvature. We want concave in both the cervical and the lumbar, and concave in the thoracic, which he has. I see no scoliosis, or no kyphosis, no lordosis. Going to have you bend over. I'm going to check for scoliosis as well as your flexion. Good. A nice straight spine, so no scoliosis, and good full flexion there. Going to go ahead and have you tilt back and extend. Good extension on the back. Now I'm going to have you put your hands here. I'm going to have you pivot just your shoulders. Good. Full range of motion there. Now I'm going to have you place your arms at your side like this and run your hand down like this. And then on the other side, so good full range of motion of the spine. Now we're going to test your leg strength. Turn around for me. I want you to stand on one leg and then bend down a little bit. Good, so full strength. Go ahead and do the other leg for me. Go ahead and bend down. Good, so full strength on that. Now, Kai, we're going to do a walking test. I'm going to have you just walk across the room. I'm looking at the swing of your arms. I'm looking at your stride. I see no shuffling. I see no leg lag. I see no wide stepping. Gait and balance is good. Going to have you walk across on your tiptoes, just about 5 steps. Good. Come back on your heels. Good gait, good balance. Now we're going to do something that's called tandem walking, about 4 steps, like this. Good, good. So good balance. So gait is not affected. Okay, go ahead and have a seat. Now I'm going to go on, or you can go play. Going to go on to the genital urinary for both the female and the male. So with the male, I'm going to go ahead and first position him. I'm going to wash my hands, put my gloves on, position him sitting on the exam table or standing, and I'm going to be sitting. I'm going to be looking at his hair pattern distribution for the Tanner scoring if he's young. Going to be looking for any rashes, any infestations. Also going to be looking at his skin, looking at the shaft of the penis, looking at the size, shape, and if he's circumcised or not. Going to palpate down the shaft of the penis, feeling for any abnormalities, lumps, those types of things. Once we get down to the glands, if he's not circumcised, I'm going to have him retract his foreskin, looking at the urethral meatus, looking for any drainage or any ulcerations. Once that's complete, then I'm going to go on to the testicular exam. I'm going to be doing one side at a time. I'm going to be feeling the testicle, feeling for any lumps, seeing if he's having any pain. Also, if there's any swelling or tenderness, feeling up at the epididymis, going along the epididymis, feeling again to see if there's any like varicosities. Then I'm going to go to the spermatic cord, follow the spermatic cord all the way up to the inguinal ring, stick my finger in the inguinal ring, have him turn his head and cough, feeling for a bulge. If there's no bulge, then he doesn't have a hernia. I'm going to do the same side, feeling the testicle, again, between my fingers, just feeling for lumps, going up to the epididymis, following the spermatic cord up to the inguinal ring, sticking my finger in, having him turn his head and cough, no bulging, so no hernia, noted. Next, we're going to do the rectal exam. As long as he is okay with that, get his approval, let him know that's what you're doing. Here, I'm going to lubricate my index finger. I'm going to have him bend over the table. I'm going to be standing. I'm going to have him bear down. I'm looking for hemorrhoids and fissures, gently inserting my finger as he's bearing down, feeling sphincter tone, do it going around 365 degrees. So both anterior, posterior, and lateral walls, feeling for any lumps, indurations, sores, hemorrhoids, stopping at the anterior to feel for the prostate, feeling for the sulcus, also feeling for the two lobes of the prostate, feeling for firmness. It should not be tender, should protrude about 1 centimeter, should feel like the tip of a pencil eraser. Then I'm going to go ahead and remove my finger and give him a tissue. Going on to the female. For the female, I'm going to wash my hands. I'm going to put gloves on. I'm going to place her in a lithotomy position and draping her so that I can see her face. First thing that I'm going to do before I touch her, I'm going to let her know that I'm touching her. I'm going to inspect her mons pubis, looking for any infestation, looking at her hair distribution, tanner scoring her, looking for rashes, lesions, anything like that. Going on down, I'm going to be looking at the labia majora and labia minor, the interosseous, looking at the clitoris, also looking at the urethra, and then going and looking at the anus for any hemorrhoids. Once that is complete, I'll take the speculum that I have soaking in warm water, put a little bit of lubrication on it. Before I touch her, I'll let her know that I'm touching her with my hand and where I'm touching her. I'm going to place my 2 fingers on the posterior wall to put a little bit of pressure as I insert the speculum. At a 45-degree angle in a slightly downward motion. Once I get to the full speculum in as far as it'll go, I'll turn it horizontal, slightly opening it to look for the cervix. If I am not able to visualize the cervix, I would retract it just slightly, reposition up, open it again, looking at, once I find the cervix and the os, I'm going to lock it. Here I'm going to be looking for any, inspecting for any bleeding, lesions, sores, the color of both the vaginal wall, the cervix, and the os. Once that is complete, then I'm going to just slightly pull back, unlock it, with downward pressure, remove the speculum. Next, I'm going to go on to the bimanual exam, and there I will go ahead and lubricate my index and my middle finger. I will gently insert my middle finger and my index finger, feeling for any cervical motion tenderness, watching her face to see if she's grimacing, just moving the cervix around, also feeling for any indurations or any lumps or the smoothness of the vagina. Once that is complete, I am going to go ahead and feel for her uterus. With this, I'm going to be taking my non-dominant hand, that's ungloved, feeling at the top of her abdomen or about at the navel line, pushing her uterus down, feeling the size, the firmness, if it's fixed or movable, seeing if she's having any pain. And then I'm going to go on to feeling the adnexe. Here I'm going to go ahead and point my fingers towards the right, with my hand on her abdomen, scooping the adnexe between the 2 fingers, trying to capture it. She might have a twinge of pain, but otherwise shouldn't be painful. Then I'm going to go ahead and feel the size and the consistency. Should be about the size of an almond, and feeling if it's hard, if there's any lumps, and it should be movable. Then I'm going on to the left, so pointing my fingers towards the left, again, trying to capture that over using that sweeping motion, capturing it, feeling if it's movable, feeling if there's any lumps, feeling if there's seeing if she's having any pain with that. And once I'm done with that, then I'll remove my fingers from her vagina, and that's the end of the exam.